Digital twins in healthcare. My name is Landon. I'm a computer science student at Middle Georgia State University. And I'm going to kind of give a brief overview of why I believe that the use of digital twins in healthcare could be one of the most significant developments in modern medicine. So, what are digital twins? Digital twins are virtual objects and/or processes that are created, tested, and examined to better understand the capabilities of physical objects and/or processes. Some examples of digital twins would include Rolls-Royce's Intelligent Engine, which is a program aimed at creating digital twins of each engine that Rolls-Royce produces. This is to test performance and to maintain a consistent engine platform for each car that they produce. Another example of digital twins is the Crossrail in London. The Crossrail in London is a high-speed commuter train, and it used digital twinning in the production phase for user satisfaction purposes and performance as well. And finally, the Icelandic company Össur uses digital twinning to create prosthetics for amputees. Technology used in medicine currently, a few technologies that are currently used to diagnose and treat illnesses include endoscopy, of course, x-ray machines, and something called RPM, which is the remote patient monitoring tool. These tools, of course, are incredibly groundbreaking, and most people either have used them themselves or are very familiar with their use cases. What could the future of medical technology look like? So, AI, artificial intelligence, will be something that is widely used by doctors around the globe. Of course, AI can't make decisions for doctors. That was never intended to be the case. But AI, because it has such a vast amount of data integrated into it, it could help doctors in correctly diagnosing patients under certain conditions. Digital twin integration. So, of course, doctors are medical professionals. So, with their expertise combined with an engineer's creative mind, I do believe that they could work together to create, either digital processes or digital objects that could simulate the way that the body moves, the way that the body functions, the way that we think about our body. All of those types of things could really be explored whenever engineers and doctors get together to create the tools that most people can't even imagine. So risks. Of course, anytime you're integrating information of any kind into an electronic system, that's going to be very difficult in terms of conformance. But especially when you're dealing with, not customer, but patient records. This is already sensitive information. Putting that into a mechanical device that we especially as a patient, you would not know where that's going. This can be really dangerous. Of course, if the system is hacked, all of that information could be exposed. Biased algorithms. So unless these systems know every single detail of every single human, there's no possible way that it could be 100% accurate 100% of the time. And finally, who owns that data? Can that data be sold? Those are all questions that compliance specialists will have to work together to create some sort of framework regarding those risks. Finally, of course, rewards, processes, and risk can seem overwhelming, but the gain of integrating these systems with healthcare professionals and even using patient data, as long as it's done the right way, we could see enhanced training capabilities. Predictive healthcare is super important. Um, you know, as far as healthcare workers are concerned, you're kind of on the tail end, right? You're always treating symptoms and signs, and if we can catch those things early, then maybe they could help a lot of people way before it costs them thousands of dollars.